Ladies and gentlemen, friends and colleagues, welcome to our 9th webinar. And as you can see, our topic is post-COVID hypertension and its management. Now, here is a special welcome to my dear colleague Divya, who I see is listening in all the way from New Zealand, or it could be Australia. Divya was our head of academics about 5 years back, and then she moved on to greener pastures. Well, we live in a desert, so there's no reason why that shouldn't be. She moved on to greener pastures and is now in New Zealand, or it could be Australia. A special welcome to you, Divya. God bless you. Now, ladies and gentlemen, when we decided, or the reason why we decided that we would talk about hypertension and its management post-COVID was in our reading, we found that over 30% of COVID patients were hypertensive. Now, whether this was due to age, or whether it was due to COVID, or whether it was due to hypertension as an independent factor, we were not quite clear. However, studies from the United States, China, and Italy subsequently confirmed that about 56% of seriously ill COVID patients were hypertensive. And therefore, we thought that we must select our best speakers to talk on this subject. And as is our format, we have two speakers, one who will talk about the medical aspects of the subject, and the second who will talk about the lifestyle aspects of the subject. Now, to handle the medical component of the topic, post-COVID hypertension and its management, is Dr. Imran R. Rangrezi. Now, Dr. Imran, very learned, but Dr. Imran did his medical studies in MBBS as well as his MD from the beautiful state of Kashmir. I believe his college was in Srinagar. He then qualified for the MRCP from UK and also the FRCP, that would be the Fellow of the Royal College of Physicians and a member of the Royal College of Physicians. And if that was not enough with his UK certification, he went on to get an FACP from the United States. And add to that his 17 years of vast clinical experience as a specialist in internal medicine and also a professor in the RAC College of Medical and Health Sciences next door. He has published numerous research papers and publications in various national and international papers and has made several presentations. He is also an active member of the British Geriatric Society, and that includes me. I'm not a member of the society, but I'm a geriatric, so that includes me, and the European Society of Geriatric Medicine. But the reason why Dr. Imran is here today at our request is because he is an expert, not only in diabetes and thyroid disorders and respiratory orders, etc., respiratory diseases, etc., but most so because of his expertise in infectious disease and, most importantly, hypertension. I mean, that brief introduction, which does no justice to Dr. Imran, I now hand you over to Dr. Imran. Dr. Imran, Unmute and go ahead, sir.
Thank you so much for your kind words. Thank you so much for a beautiful introduction. Uh, I will share my slides. So, in the next 20 minutes, I'll be discussing one of the most important and one of the most common lifestyle problem, which is high blood pressure, also called as hypertension. So, I'll be discussing about must know facts, and I'll be discussing certain patient scenarios with you, how patients present to me, so that you will become more familiar. So I'll be discussing now the definition of high blood pressure, which is called hypertension. I'll classify the high blood pressure. I'll tell you some important techniques about the blood pressure measurement. We'll see the clinical features of these patients, and we'll see whether COVID vaccine, and hypertension are linked to each other or not. And at the end, I'll be discussing about the management of these patients. So here we go. So what is blood pressure? Blood pressure is the force or pressure applied by the blood over these inside walls of the vessels. So the pressure applied over the walls of these arteries is called blood pressure. And when the pressure is high, it's called high blood pressure. So that's why it's also called as hypertension. And once the pressure increases within these blood cells, what's going to happen? This increased blood pressure or hypertension is going to affect the inner lining of our blood vessels. So, what will happen because of that? This will result in the formation of clots. This will block these blood vessels. So, what will happen with this blockage of blood vessels? The patient can present as MI, heart attacks. The patient can present as stroke. The patient can present as renal failures. And sometimes, when the pressure is high, it can cause increased wear and tear of these blood vessels. These vessels will stiffen, these vessels will get hardened up. And what will happen? If they become hardened up, they become fragile, and these blood vessels will rupture. This is what happens in brain hemorrhage. So these patients can present as brain hemorrhage too. So that's why we have to take care of this high blood pressure, which is called hypertension. Now, blood pressure is written as systolic and diastolic. So you are familiar with these terms, blood pressure of 120 over 80. 120 is the systolic blood pressure and 80 is the diastolic blood pressure. So this is a normal blood pressure. So you can see this graph here. So if I see your blood pressure is 120 over 80, that does not mean it will stay same throughout the day. It's going to change. You can see these fluctuations in these blood pressure recordings. During day, our blood pressure is usually high because we work, we argue, we are under stress. So our blood pressure is usually high during day, while during night, it usually dips. So this was about the definition of hypertension. Now, second, we should know about the different classification of hypertension. So why this slide is important? It's because most of our patients, they stay at home even if their blood pressure is 160, 100. I have seen so many patients. They say that our blood pressure was 140, 80. I thought this is a normal blood pressure. So I'm just doing my routine. And one of my friend told me, no, 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 this is high. You can just go to the doctor and just have a checkup. So this slide is very important. You should know what is normal and what are the abnormal blood pressure readings. So the normal blood pressure readings, as you can see here in this screen, is less than 120 systolic and less than 80 diastolic. So you should remember these levels. And if it is from 120 to 129, as per the latest AHA guidelines, this is elevated blood pressure. So 120 to 129 is elevated blood pressure, and stage 1 and stage 2 means if the blood pressure is 130 over 139 and if diastolic is 80 to 89, and if blood pressure is more than 140 over 90, this means patient has high blood pressure and he needs treatment. He should come to visit a physician. And hypertensive crisis means the patient has to consult our doctor immediately. The patient is in crisis. Blood pressure is more than 180 and diastolic is 120. I told you why the patient is in crisis, because if the blood pressure rises, the vessels can rupture. That's why we divide them into urgency and emergency. If blood pressure is more than 220, the patient will report to ER, unfortunately. With encephalopathy, the patient can present with heart failure, the patient can present as brain hemorrhage, patient can present as blindness. So we have to know abnormal and normal blood pressure readings. Now, what causes hypertension? As you can see here, more than 90% of the cases we don't know the cause. 90 to 95% of the cases we don't know the etiology of hypertension. That's why it's called idiopathic or essential hypertension. And the second most common cause are kidney problems. Then patient can have endocrine problems like hypo and hyperthyroidism, Cushing syndrome, or it could be drug induced. Which drug? Which drug do we use commonly? Steroids. Steroids can cause high blood pressure. A patient, a female who is taking oral contraceptives, she's at risk of getting hypertension. And this hypertension is called secondary hypertension because it's secondary to the drug use. It could happen during pregnancy. It's called pregnancy-induced hypertension. And these patients may persist with this hypertension or they may improve after delivery. So these are some of the most common causes of hypertension. And you can see more than 90% are idiopathic. Now, how do they present? Most of these hypertensive patients are asymptomatic. They don't have any symptoms. It is a silent killer. So please remember, if you don't have symptoms, that does not mean that you don't have hypertension. Hypertension patients, most of them are having no clinical features. And some of them may present some non-specific symptoms. What are those non-specific symptoms? Palpitations, dizziness, and majority of patients usually present with headache, occipital headache. And some unfortunate ones, they present directly as renal failure, they present as stroke, they present as heart attacks, they present as blindness. Now that you know about different blood pressure ranges, now you want to check your blood pressure. I'm sure you're familiar with all these devices. And the most common is this one, electronic one. Why is it more famous? Because it's easy to use, easily available. You don't need any training for this, but you should get a better apparatus of good quality, FDA approved, and it should be validated and you should take care of its batteries. Rest, it's a very good device. The second one is the mercury based and the aneroid ones. Mercury based, it needs some, and aneroid one, it needs some training and it needs different cuff sizes because for kids we have different cuff size, for adults we have different cuff size. Because if you use children cuff size for adults, you will get a very high blood pressure recording. And there was an research in 2016 in one of the journals that compared all the three devices. And it was reported that we can use electronic device instead of mercury or aneroid BP devices at community level. So it's safe to use electronic devices in when you don't have mercury or aneroid ones. So at community levels, it can be safely used. Now you got the device. Now you have to check your blood pressure. So what are the important things? What are the important technique that you should use to avoid spikes in the blood pressure? The cuff of this blood pressure device should sit directly on the bare skin and not over the clothing. It has been seen that this can increase your blood pressure reading from 10 to 40 millimeters of mercury. So how important, suppose you are wearing a shirt, you are wearing a jacket and you put your cuff over the clothing. This can increase your blood pressure reading from 10 to 40 millimeters of mercury. You should avoid added salt and fried foods on that day. You should maintain a proper posture. What does it mean, maintain a proper posture while you are taking these blood pressure recordings? Proper posture means you should keep your feet on the ground. You should not sit cross-legged because it has been seen a patient who sits cross-legged, his blood pressure recording may vary from 5 to 15 millimeters of mercury. These are some basic points, but I'm sure most of us, they don't take care of these things. Avoid checking blood pressure in a cold room. Empty the bladder before taking a blood pressure test. It has been seen there is an increase of 5 to 10 millimeters of mercury if you want to empty your bladder before taking a blood pressure test. Avoid talking during the test and use the same arm. Don't change that. For example, you will put it on the right arm, and then you will change it to the left arm. Normally, we have some pressure differences on two sides. So avoid doing that. Avoid smoking, avoid drinking alcohol or caffeine, coffee, and avoid exercise for 30 minutes before taking blood pressure. Why I'm saying all these things? Why is it important? I have seen these patients coming to me. I have seen one of my patients who was on my follow-up. I just prescribed one of the blood pressure medication, and I was sure the dose was perfect for him. And after 1 week, he came back to me and he said that, no, doctor, my blood pressure is not controlled. So I was like shocked, what's happening? So what I did is I just revised the history again. I just told him, okay, what is your technique of blood pressure? What about your blood pressure device? Is it validated? Is it okay? Our battery is fine. They said, no, absolutely fine. It's validated. It's absolutely okay. Then I told him, okay, how do you check your blood pressure? He said, okay, once I go for jogging, I hit the gym, and immediately thereafter I start taking my blood pressure. So he was of the opinion that exercise decreases blood pressure. So that's okay. Exercise decreases blood pressure. But what he was doing is just after hitting the gym, he went on to check his blood pressure. And obviously it will be high. So that was the reason of his high blood pressure. These are some simple things, and we should follow all these steps to get the proper readings. So never rely on one blood pressure recording, as well as American Heart Association, American Medical Association. They say that we should take 3 readings and take an average of these 3 readings. First reading is usually highest and inaccurate. Always take 3 readings, 1 minute apart, and you should take it twice a day, one morning, one evening. Now you have got the device and you're checking your blood pressure. Your blood pressure is absolutely fine. Absolutely fine means less than 120/80. But now you are going to your physician. You're attending some clinics. You are going to vaccination centers. Let's talk of this pandemic, because I see lot of patients coming from these vaccination centers. They have been referred to us. This patient has high blood pressure. Please take care of these patients. So once we start taking history, we tell them, okay, do you have any history of hypertension? They'll say, no. At home, our blood pressure is absolutely fine. We don't have any family history. I'm not taking any medicines. I'm absolutely okay. I don't have any symptoms. But once I go to vaccination center, my blood pressure rises. My blood pressure is high. They say, no, we will not give you vaccination. And I've come across so many articles in the newspaper that one person was refused vaccination for 7 times. On 8th attempt, he was just given vaccination. What was the cause? Cause was white coat hypertension. White coat hypertension means elevated clinic blood pressures. At home, he's absolutely fine. His ambulatory blood pressure monitoring is absolutely okay. His home blood pressure levels are absolutely fine. He's checking his blood pressure normally in the morning and in the evening. He says, I'm absolutely fine. But once I go to clinic, once I see a physician, my blood pressure recordings are high. This is called white coat hypertension. Now, this is the ambulatory blood pressure monitoring. You just tie these blood pressure monitors. There's a portable device, and the cuff is tied on his arm. And this blood pressure monitor, it will monitor his blood pressure every 10, 20, 30 minutes when the patient is awake or during sleep. And at the end of 24 hours, we'll take a recording. Now about this white coat hypertension. Now, if the patient comes to you, what will you do? Will you treat him with antihypertensives? No, they don't have any hypertension. Why should you treat them with medicines? The most important thing is reduce their anxiety. because this hypertension is not because of some hormonal changes. This hypertension is because of their stress. This hypertension is because of their anxiety. So reduce anxiety. Familiarize and acclimatize these patients. How? Ask these patients to check their blood pressure at home. They should be familiar with the BP apparatus. They should not fear this apparatus. So they should routinely do their blood pressure checkup at home. They should familiarize themselves with this device. Practice meditation, take some deep breaths, relaxation exercises, multiple readings. Don't take one reading and stop it there. No, take an average of 3 readings. And diet is very, very, very important. I'm sure Dr. Vilku will take care of the diet portion, but yes, you have to cut back on processed food, junk food, and high sodium food. Now, $1 million question here: is hypertension linked to COVID 19? Now, let's see what research says. American Heart Association has reported that 40% of COVID 19 patients have cardiovascular or cerebrovascular diseases. There was the same data from China also, that most of the patients of COVID 19 had hypertension. And it was seen that these patients have high mortality and morbidity, especially when hypertension was associated with coronary artery disease, diabetes, obesity, or chronic obstructive lung diseases. Deaths were 12 times more high, and renal insufficiency or renal failure was very common. Now, let's see why COVID is more common in hypertension, or why hypertension is more common in COVID patients. The most important thing here is there is increased incidence of hypertension. If we talk of US population, half of the US population, 48, 49% of the US population is hypertensive. So every other person is hypertensive. So the chance of getting COVID is more. Second, it was more common in elderly, and geriatric population was the worst hit. Why geriatric population was worst hit? Geriatric population was first hit because 63% of these patients have hypertension and they have other comorbidities. They have diabetes, they have chronic obstructive lung diseases, they're obese, they have decreased immune system. Chance of getting COVID in them was high. They have suppressed immune system because of these comorbidities. So the chance of getting COVID infection in geriatric population was high, and mortality and morbidity was also high because they have so many comorbidities associated. COVID can complicate renal renal features, like it can cause renal failure. As I told you, renal failure is an important cause of hypertension. Or we can say hypertension causes renal failure and renal failure can cause hypertension. It can precipitate, it's vice versa. So if you see, most of these COVID patients have renal failure. So most of them may present or persist as hypertension. So that could be one of the cause. And the most important one is it interacts, this coronavirus infection or COVID-19, it causes imbalance of renin, angiotensin, aldosterone system. It's a neurohormonal system which helps to maintain our blood pressure and blood volume. It has been seen to affect cardiomyocytes, cells in the heart. It can cause acute inflammation within the heart. So this could be another reason why hypertension is more common in COVID and why COVID is more common in hypertension patients. So how can we control our blood pressure? First and foremost, and the most important thing is lifestyle modification. And the second, I would say lifestyle modification and medical management. I won't say it's only medical management. No, it's not only medical management. It has to be lifestyle modification and medical management. Now, what are these lifestyle modifications? We have to improve our diet. We have to include more of fresh fruits and vegetables. We have to exercise. It's not always we have to go to gym. We can exercise for 20 minutes per day, 5 times a day. That could be sufficient. Avoid stress. Go for meditation, deep breathing, avoid alcohol, and quit smoking. Dr. Wilco will take care of rest of the things, lifestyle modifications. And this is the treatment. How and when should we start treatment, medical management? So you can see here normal blood pressure and elevated BP. Most of the times, we don't require any medical treatment for these two stages, only lifestyle modifications. Reassess after 3 to 6 months. Stage 1 hypertension. Stage 1 hypertension is 130 to 139. If risk is less than 10%, see, it's important here. If the cardiovascular risk, 10-year cardiovascular risk is less than 10%, only lifestyle modifications. Reassess after 3 to 6 months. If the patient is not controlled, then only give medical management. So I'm trying to reassess how much lifestyle modifications are important. Normal, elevated, even in stage 1 hypertension. If your risk is low, lifestyle modification can take care. If the cardiovascular risk is more than 10%, then only we have to start our medication in addition to lifestyle modifications. This is very important. It's not only medical management. And for stage 2 hypertension, which is more than 140 or 90, we have to start medicines. So I will not talk about different medicines which are used in COVID, which are used in hypertension, because everybody is aware. And this slide is more important because there was a lot of confusion whether we should use this class of medicines or not. I've included just to avoid confusion so that everybody is okay to use this, because there's a growing body of evidence that we should use ACE inhibitors and ARBs in COVID-19 patients, and they are absolutely safe. We should continue using ARBs and ACE inhibitors. Now, is COVID-19 vaccine and hypertension related? Now, is it normal for your blood pressure to rise post-vaccination? Yes, it can rise. It can rise. What is the commonest cause? Commonest cause is their stress. Once they go for vaccination, it's their anxiety. It's their stress that leads to increase in blood pressure. And what is the other cause? The other cause could be strong pain response. Once they get the jab, they get severe pain, and that might increase their blood pressure to some extent. Though there was one study which was done in Switzerland, they showed that 9 patients developed extreme hypertension minutes after vaccination. It was in 2021, but out of those 9 patients, 8 patients were already diagnosed as hypertension. That means they had aggravation or precipitation of their hypertension levels. But till date, hypertension or an apparent change in hypertension recordings is not a side effect or adverse effect of any of the COVID vaccine. We don't have any other research available which suggests that hypertension, these vaccines can cause high blood pressure. So they are absolutely safe. Whatever high blood pressure recordings you get may be because of your stress, or maybe because of your anxiety or pain associated. Now, the take-home message, what we discussed so far, is that hypertension is a silent killer. You need not to have symptoms to come to a doctor. You should screen yourself for high blood pressure. Patient with uncontrolled or untreated high blood pressures with other comorbidities may be at risk of getting severely ill with COVID-19 patients. This is very important. Hypertension with other comorbidities are at risk of getting severely ill. If you have mild hypertension, it's not at high risk. It has a mild risk. So meditation, medication, and lifestyle changes offer a powerful combination for reducing these health issues. Good control, again, I'm telling you, good control of blood pressure is associated with low risk of cardiovascular disease. And how to prevent corona infection? Get yourself vaccinated. They are totally safe. You have to follow social distancing and other preventive measures. You have to stay safe. You have to stay healthy. And may God bless us all. This is what I had today. With this slide, I conclude my session today. Thank you so much, RAC Hospital. Thank you so much, Professor Kennedy, for giving me this time. Thank you, all the participants. And over to you, Professor Kennedy. Thank you.
Dr. Imran, what you said was music to my ears. It really was. It really was in so many different ways.
Thank you.
Okay,
Thank
now,
you so much.
my take-home message from this is that if hypertension is to be managed, we have two lines of treatment. Certainly, the main line of treatment is medical management, which our esteemed colleagues in the medical profession take care of. But what delights me is your emphasis on lifestyle modification. Now, this is an area in which my colleagues and I have been meeting with the medical profession to try and have this included as part of their therapy for the last 4 or 5 decades. And Dr. Imran, you have very kindly emphasized that beyond medical management, there is lifestyle modification. You spoke about exercise, you spoke about stress, diet, meditation, avoid alcohol and smoking. You mentioned these things. And now, to support your argument, we have our second speaker for the day, and that is our very own Dr. H.S. Wilku. Now, Dr. Wilku is well known not only to us, but also to his 65,000 corporate patients, colleagues, call it what you wish. He counsels that many individuals at the rate of 50 to 60 individuals every day on the great benefits of lifestyle medicine. And that includes 12,000 children. And he does it with the authority that he is certified by the American College of Lifestyle Medicine and the American College of Preventive Medicine. He is a lifestyle, and in addition, he is a CCWS, which would mean that he is a specialist in corporate wellness. From time to time, we conduct talks, and at this point of time, we are at our 9th webinar, but Dr. Wilku has completed 2,600 talks in the UAE and India. He is a faculty with the Apollo Hospitals Education Research Foundation, the Tata School of Nursing, and even in our own institution next door, the RAC Medical Health Sciences University. And his pet topic is not just lifestyle medicine, but also wellness management. Dr. Wilku, some words of wisdom from you in the area of lifestyle therapy in relation to hypertension. To you, Dr. Wilku.
Thank you, Professor Kennedy, for kind words. Thank you, Dr. Imran, for a wonderful presentation. You have put all points, lifestyle, medicine, and medical aspects, point to point, so that it's very understandable for a layman. Thank you very much. So today we are talking about hypertension and its management. See, hypertension is a very vast subject, and it's also known as silent killer. Like Dr. Imran mentioned, 90 to 95% cases are undiagnosed. People even having hypertension, elevated blood pressure, they don't know whether they are suffering because they don't have any sign and symptoms until unless they have some secondary cause like Dr. Imran mentioned. We, during health screening, like Professor mentioned, we are doing corporate wellness programs every day. So we are doing health screening for 60 to 70 employees in the corporate. And we found 30 to 35% of people, they don't know about their hypertension. They say that we don't have any symptoms. So we never checked. During the check we did, Dr. Imran has also mentioned about white collar hypertension, because when an individual steps in for a health checkup, due to anxiety and stress, their blood pressure goes up. So that is the first rule. What we do, we let the patient sit for 5 to 10 minutes, and then we go according to that. And at the last moment, we are checking the blood pressure. We make the patient, individual or the client, comfortable so that he is eased and blood pressure will be normal. So why we want hypertension management? What is the importance? As everyone knows, hypertension is a silent killer, but we also knows if you don't know about it, it can cause hazardous damage to vital organs like brain. There may be stroke, there may be cerebral hemorrhage. If you talk about heart, myocardial infarction, congestive cardiac failure. If you go about eyes, retinal hemorrhage, retinal compression. If you go on kidneys, chronic kidney disease, even the renal failure, peripheral vascular disease. So these are common things. And these are happening just because of uncontrolled hypertension. How it is coming uncontrolled, whether either the person doesn't know about it, or even if he is being diagnosed, they don't follow the instruction of a doctor, because they say we don't have any symptoms, so why should we go for any management, why should we take medicine? Many people do like that. So these are uncontrolled situation where a gross damage to vital organs happen. So how to do that, and who are the people who are at risk? What is the importance of knowing about it? See, risk group can be divided into three. Basically, when we see non-modifiable risk factors, non-modifiable means which we can't modify, like our family history of any medical problems, our age, gender, race. We can't modify that. Then the medical aspect. If a family history or your medical history is having chronic kidney disease or diabetes or hyperlipidemia or even the thyroid problems, there are a lot in the list, but I'm just giving you a few examples of medical ailments. Third comes modifiable. This we can modify with lifestyle medicine, like obesity, sedentary lifestyle, chronic stress, alcohol, tobacco, smoking, and the faulty diet. Diet rich in salt, fat, and commercial food. So these things we have to take care. When we talk about modifiable, 80% of the non-communicable disease are due to lifestyle. All these fall under this non-communicable disease, and we should be careful. And like everyone knows, and Dr. Imran has also mentioned about this, hypertension can be managed by lifestyle medicine or lifestyle management, along with medication wherever it is required. But your modification should be there. The first tool for hypertension management is diet management. Now, whenever we are going for a diet management, diet planning, make a diet regime, you should be knowing about various factors like what is your BMI, what is your allergies to food, and what is any comorbid conditions if you have, and like these things. Then only you can make a proper diet regime. But when we talk about hypertension, we focus simply on DASH diet. What is DASH diet? Dietary approach to stop hypertension. It's a basic thing. It's not a rocket science, but in a systematic, scientific manner, we say DASH diet includes low in sodium, low in saturated fat, low in carbs, high in fibers, and vegetables. These things are the DASH component. So when we talk about DASH diet, so we'll be talking about simple samples of that. If you are hypertensive, now there are three categories. One is pre-hypertensive, and second is hypertensive with or without medication. When we say, okay, it is pre-hypertensive, you don't require any medication, but you have to control your blood pressure. So DASH diet is the best tool to control it. Second comes, if you are hypertensive, whether you are on medication or whether you are not on medication, still you require lifestyle management, and DASH diet is one of the important factors in it. It will help to reduce the blood pressure. It will help to reverse the blood pressure. If you do it properly, it will help you to reverse it also. It will help to manage the impact on vital organs. It will help to reduce the comorbid conditions. So what we have to do? Simple. Every day increase one serving of vegetables. When we are talking about vegetables, we basically mean green leafy vegetables. Why we need that? We require minerals and vitamins from it. What specific minerals we require? We require potassium, magnesium. These are the minerals which we require to control hypertension. We will talk detail on this. Then, if you are vegetarian, you should have all protein sources from vegetables like soya food, cottage cheese. These type of things you should be preferring as a vegetable protein. Increase 1 to 2 servings of fruit, not a juice, whole fruit. Eat a fruit. So what fruit you should prefer? You can eat any fruit. The rainbow of colors you can use. There is no issue with that. But when we are talking about hypertension, we should be preferring fruits which are high in potassium, because potassium is known to antagonize your blood pressure. It helps to reduce the blood pressure. When there is a mechanism of blood pressure control, that mechanism, the pathophysiology is helpful when there is an increase of potassium. Then increase nuts and seeds, beans, which are high in magnesium. Again, this helps to increase the elasticity of your vessels. Once your elastic component of your vessels are more, your blood pressure will be more controlled. If your vessels, the arteries are stiffened, the blood pressure will rise. There will be less chance of flexibility. So increase magnesium. And how you will get it? From nuts, seeds, and beans. Increase drinking of normal water, 8 to 10 glasses, preferably little colder than the room temperature. And in sips, avoid drinking in a bulk amount. Because see, when we drink water, if it is little colder than the room temperature, it is immediately absorbed in the blood vessels. When blood absorbs water, temperature goes down, volume increases. When there is increase in the volume, your filtration through the kidney, urination will be profuse. Once your urinations are more, your volume will again, in respect, it will drop, reducing your blood pressure. Then don't go for bulk amount. Why? Because suppose if a person is having a comorbid condition of a kidney failure or a congestive kidney problems. So if you drink more water, doctor used to say, okay, drink little water. Actually, little water means, it doesn't mean the throughout day you are reducing your intake of water. It should be one time you should reduce your intake. That's why we say sip of water. Reduce saturated fat. What is saturated fat? Any fat, any oil which remains solid in room temperature is a saturated. For layman understanding, we can say like that. And any oil or fat which remains liquid in room temperature is unsaturated. We should be preferring unsaturated. Now, salt, which is a white terror. For hypertension, we used to call it white terror. What is that? When you have high sodium intake, sodium has a capacity to retain water in your body. You might notice people who have high blood pressure, if they are taking high salt, their kidney functions reduces. There is edema, peripheral edema, swelling of feet. So these things directly are impacted by high sodium intake. So when we talk about sodium, you have to reduce salt, that is common salt, which is high in sodium. Preferably, you should take salt high in potassium, like rock salt or Himalayan salt. These type of salt, unrefined salt, these are high in potassium. This will help you to reduce your blood pressure. Then comes carbonated drink. Any fizzy drinks you have to reduce. Why? Because carbonated drink, the carbon dioxide charged in the drinks, cold drinks, this causes loss of calcium. And calcium is very important for controlling blood pressure. Also, the stiffness of the muscles. The muscles elasticity is lost. So when we drink more carbonated drink, your calcium from the food which you are taking is not absorbed and is lost. So you have to reduce your carbonated drink also. Then comes the caffeine. There are many myths. Caffeine, like coffee, if we are talking about black coffee, immediately it increases the blood pressure. Many people we come across when we are doing the counseling, we come across people saying, okay, we heard that drinking coffee is very good for heart. Actually, caffeine increases our heart rate. It increases your blood pressure. For people, those who have pre-hypertension or hypertension, with or without medication, they should be careful about taking increased quantity of caffeine. I would rather prefer to avoid caffeine. If you love to eat, if you're fond of drinking some hot drinks, you can go for green tea. Green tea is high in antioxidants, which helps you. Then, when we talk about these foods, there are some foods specifically beneficial for blood pressure. We call it superfoods. In every therapeutic diet management, we have some foods which are very beneficial for a certain ailment. When we are talking about hypertension, so we'll talk about superfoods for hypertension. We categorize into three: vegetables, fruits, and miscellaneous. Vegetables, green leafy vegetables. Why we said, earlier slide we have already mentioned, leafy vegetables are high in fiber, they are high in minerals. We require minerals to metabolize and help your blood pressure to be controlled. Beans and legumes. Why beans and legumes? These are rich in magnesium. Broccoli, rich in potassium. Table radish, garlic, tomato, spinach, beetroot, beet greens, kale, celery. If you go according to these are rich in minerals, especially potassium and vitamin C. These are very good for management of your blood pressure, as well as any chronic ailment. Specifically, when we go about garlic, garlic has an active ingredient known as garlane, which helps immediately to reduce your heart rate and gives you faster recovery for your heart muscles to be relaxed. Same as tomato. Tomato contains lycopene, which is very helpful for heart. Fruits, oranges, grapefruit, lime, watermelon, banana, blueberries. These are rich in potassium and vitamin C. This is very good. Now, banana we used to say spotted. When the skin has spot, that time the banana is rich in potassium. That banana is very good. Like miscellaneous in a dairy product, yogurt. It's very good to start your day with yogurt. Nuts and seeds like walnuts, chia seeds, flax seeds. If you love to eat fish, salmon and sardines are the best choice. And if you are a vegetarian, protein should be taken from soya or cottage cheese. Now comes the second component. This component is the second best tool to manage your hypertension. Now, exercise regime can be made with various components. But when we are talking about hypertension, we basically want to talk about cardiopulmonary exercise. There are various exercises for cardio, but simple understanding, it's not required whether you have to go to a gym or whether you can do it at home. simple thing for cardiopulmonary exercise, which is very beneficial, are walking, brisk walking especially, slow jogging, jog and walk, swimming, cycling, elliptical machine. Then when you're doing a cardio exercise, you should be very careful about doing an exercise and how much your heart rate should go, whether there is a bad effect on the heart or not. Before making any exercise regime, you should take clearance from your professional medical advisor or your treating physician. He will suggest you, okay, you can go for these exercise, you can't do these exercise, then only you can start planning. What I'm telling you is very simple, it's very useful without giving any impact. But you should be careful about your heart rate. When you're doing about any exercise, especially the cardio exercise, your heart rate has to be within a limit to get the maximum benefit and to prevent any adverse effect. Generally, when we say pre-hypertensive, if you are pre-hypertensive, your heart rate during the exercise should be between 150 to 130 beats per minute. And if you are hypertensive, whether you are on medication or without, your heart rate should be between 130 to 110 beats per minute. Plus, very important, when you do cardio exercise, your heart rate increases. We already are saying, talking about that. Then you need maximum pumping of oxygen. So immediately after your cardio exercise, do a breathing exercise. Various methods of breathing exercise are there. We generally say yogic breathing, anulom vilom, that is alternate nostril breathing. Bhastrika, forced belly breathing. Western breathing, diaphragmatic breathing, a pursed lip breathing. These are very good. This will help you to increase your oxygen uptake and absorption. See, everyone knows what is the benefit of exercise, but when we are talking about hypertension, we will just go through how chain reaction helps your blood pressure. Once you do cardio exercise, it relaxes your muscles, reducing your arterial tension. It increases the release of endorphins, the good hormone. Then good hormones induces a good sleep, resulting in mental relaxation. Once you have mental and physical relaxation, your heart rate improves. When your heart rate improves, your stamina increases. If you continue doing exercise, your kidney filtration is good. It will help you to reduce your weight. Now comes the health habits. Two health habits like tobacco and alcohol. When we talk about tobacco, there are more than 4,000 odd chemicals in tobacco. Every chemical has impact of various things. But when we are talking about hypertension, we are talking basically on three chemicals. Carbon monoxide. When you smoke, carbon monoxide destroys the oxygen. The acids in tobacco destroy the lung tissue. Again, once your lung tissue is destroyed, your gases exchange, the absorption of oxygen will be reduced. Alcohol, this cauterizes the brain. When your brains are cauterized, the function of brain will be reduced. The good hormones, the endorphins will be reduced. What will be the impact? Your blood pressure will go up. Your good cholesterol, the HDL, will reduce. Your LDL, the bad cholesterol, increases. LDL is responsible basically for making a clot, plaque. And this altogether damages the arteries and blood vessels. The compromised health impacts increases the risk of heart attack. Next comes the alcohol. See, though alcohol has some good effects on the body, but when we are talking about hypertension, if you are consuming alcohol outside the limit or more than the limit, it immediately gives you an impact and also a long run impact. Increases your blood pressure, increases your LDL. Again, LDL is in factor for making a clot. Increases the triglyceride. Triglyceride and LDL both functions to create a clot and plaque formation. It reduces the HDL, the good cholesterol. Again, all together these create increase in high risk of heart attacks. So whatever we discussed was a lifestyle management. In a short, we will recap again. Have a regular medical checkup, especially when you have a family history of high blood pressure, or if you are pre-hypertensive, or if you are hypertensive. If you are taking medicine, many people avoid medicine because there is a myth. Once you start medicine for your blood pressure, you have to take it long life. It's not that. If you manage your blood pressure properly, your medicine can be reduced. Many people we have noticed, we come across every day. People stop taking medicines once their blood pressure drops. And again, when they come for a next year health checkup, so again we find their blood pressure are elevated, very high. What happens? They say, we stopped medicine because the blood pressure was normal. It should not be like that. Always monitor your blood pressure. If you are hypertensive, you should be doing daily, weekly, or fortnightly as suggested by your doctor. Take your medication if prescribed regularly. Don't skip your medication. Let doctor decide how much dose or how much dose has to be reduced. Don't take your call. Avoid extra salt. Limit your salt below 1 teaspoon per day. Avoid caffeine. Avoid tobacco in any form, whether you are using smoking, a shisha, or hookah, a pipe, cigar, anything, even if you are chewing oral tobacco. Avoid commercial food. Drink 8 to 10, 12 glasses of water, normal water, especially a little colder than the room temperature, and try to drink in sips so that you always keep yourself hydrated. Do a regular exercise, cardio and breathing. If you are doing exercise, 30 minutes daily is good enough, or 150 minutes per week. Manage your stress. Stress is known to be a very causative factor and a trigger factor for your blood pressure. So that was for the today. I hope people have understood a lot things. If you have any confusions, we are there to help you. Thank you, Professor. Over to you.
Dr. Wilku, that was the best talk I have heard on lifestyle medicine in a long, long time. Congratulations and thank you so much. That was a lovely talk. That was a very, very nice talk. Thank you so much, Dr. Wilku. As a student of lifestyle medicine, I am indebted to you for that talk. Well done. That was very good. And now, ladies and gentlemen, we have the question and answer session. And I can see that this can get quite complicated. My first question is, I believe that this should be directed to Dr. Imran. Now, Doctor, I'm not necessarily going according to what I see on the screen because I have a printout of that. I'm going with some of the questions that I have here. But please do keep it on the screen so that I can go with that also. I have a question here which is similar to question 2. Yes, let's look at question 2. Question 2 says, was taking BP medication, what shall I say? I'll edit this in some ways to make it brief. Here we have a colleague or a friend who is currently has been advised not to go on BP medication, but at this point of time, he has fluctuating BP after corona. And we have another question. It says, my father had high blood pressure for the last 10 years. He is on medication and his BP is under control. But now under COVID, his BP shows fluctuation. Is it due to COVID? So we are talking really about fluctuation of BP. Your advice, Dr. Imran.
Thank you. Thank you so much for the question. A very nice question. First, let's go to the first one. Miss Priya, she said that she was taking blood pressure medications morning and evenings, and she was advised that she should not take blood pressure medication. And her blood pressure used to be normal. She used to check it at home, morning and evening. So we see this scenario again. Home blood pressure monitoring in this patient was absolutely fine. And occasionally, this patient had an episodic hypertension, one blood pressure reading which was slightly high. That will not warrant a blood pressure medication. So, why this patient was having an episodic increase in hypertension? Over the days, maybe over a month, she was absolutely fine. One day, her blood pressure was high. That means something was wrong on that day. Maybe she had eaten, her diet was not proper. She took a lot amount of salt, or maybe she was under stress, maybe she was anxious. So we have to take care of that rather than putting this patient on medication. So this one blood pressure reading should not be treated. We have to follow this patient. If this patient is very much concerned, she can come to us, we'll examine her and we'll investigate her. If there is any problem like renal problems, we'll go for renal function test. If they are abnormal, then only this patient warrants. But as per her history, she warrants only lifestyle modification. And I am sure something must have happened on that particular day. Maybe she was anxious, she was under stress, maybe her diet was not proper. That is why that one reading was abnormal. So, in my view, she does not warrant any medication, as was told to her by other two doctors. This is what was mentioned in her question. So, this I hope I answer her question. And the second question is that the patient's dad was hypertensive for the last 10 years. That means he is a chronic hypertensive. A chronic hypertension, he was well controlled. Now he is getting high spikes in blood pressure after COVID. That means something has happened. I told you there are so many reasons that can cause blood pressure to spike. What are those causes? It can affect renin, angiotensin, aldosterone system. It can cause cardiac inflammation. It can cause increased anxiety. It can cause increased stress. All these changes. It can cause renal involvement. All these changes can cause increased spike or uncontrolled blood pressure post COVID. Yes, this patient should come to us in our OPD. We will examine, we'll take a proper history, we will investigate the patient, and then accordingly, we will manage or modify his treatment. I hope I answered this question.
Okay, Dr. Imran, but we still have one more question for you, and that is the question on your screen. Is BP fluctuation in a COVID positive patient caused due to COVID infection? Is BP fluctuation caused due to COVID infection? And
Yes,
what can be done?
Yes, as I already answered this question, like, yes, BP fluctuation can happen post-COVID. As I said, post-COVID, patients are anxious, patients are under stress, they can have cardiac inflammation, they can have neurohormonal changes, they can have renal problems. All these things can predispose this patient to have high blood pressure. Yes, they can have fluctuations.
Thank you, Dr. Imran. And now, Dr. Wilku. The question on the screen, it is a notion that exercise should be avoided in high blood pressure. You have advised on the contrary that we should do exercise. So does exercise help to prevent or control high blood pressure? Dr. Wilku, this question is for you, sir. Our next topic is post-COVID ENT and eye complaints, and this will be held on the date indicated on the screen, which at this point of time, I can see once more. So that is 31st of July. We have our next session, and that is post-COVID ENT and eye complaints. Ladies and gentlemen, in closing, let me tell you that everything that we do is recorded, and all the recorded webinars appear on our website. Now, this is appearing on our website. It is www.rachospitalrehab.com. And on this, you will see all the webinars. So in case you have missed any one, you can easily catch them up again over there. And there is so much more information on this particular site, which we do in association with UNDRR and ARISE, that is the United Nations organization, and ARISE is the unit from the UAE. With that, ladies and gentlemen, have a great day, have a great weekend, and thank you so much for being part of this program. Thank you so much.